The drop punt is a standard kicking technique used in Australian rules football. It is the most popular kick used for ball progression due to its accuracy, distance and speed of execution. It is characterised by the ball spinning back along its longitudinal axis as it progresses through the air. The drop punt involves all limbs of the body, although the actual kick component predominantly utilises the lower body. Kicking is referred to as a throw-like movement, meaning that the proximal body segments are utilised first, followed by distal segments. As it is a throw-like movement, the kinetic chain is key for optimum results of scoring a goal or hitting the mark. There are 5 key phases in kicking according to a study conducted by Miller and colleagues. However, other studies show that there are 4 or 6 phases depending on their description of movement, and some phases are also given different names. The 5 phases are as follows. Approach. This is the first phase of drop punt kicking. It commences when the support leg leaves contact with the ground to begin the final step prior to kicking. Backswing. The backswing commences when the knee begins to flex, preparing the kicking limb for ball contact, and concludes when the pelvis begins to flex. Transition. This phase begins when the knee is still flexed, yet the pelvis also begins to flex. Previous studies may refer to this phase as the wind-up. The second last phase is the forward swing. Here the ankle joint becomes plantar flexed and the foot and knee are extended. Ball contact is shown to occur when the knee is flexed between 30 and 50 degrees. This phase ends when the ball comes in contact with the foot. Follow-through. The follow-through is the final stage and commonly omitted from studies as being insignificant to kicking performance. It begins following ball contact and the knee reaches full extension and hip full flexion. There are many key areas which contribute to gaining distance in an AFL drop punt. These include larger foot speed, greater shank velocity, higher ball position at ball contact, and larger final step prior to ball contact. Through increasing each of these, it is found that the ball will travel further distances. It has also been found that the optimal angle of release is between 40 to 45 degrees. A ball which is projected at this angle is predicted to gain maximal distance. A study conducted by Ditchier and colleagues in 2006 explores the kinematics of drop punt kicking in relation to accuracy. The key aim of this study was to assess the lower limb and pelvic kinematics of both kicking and support limb in a drop punt kick, in order to further examine factors related to accuracy in kicking. The participants were split into 2 groups depending on their test results, accurate and inaccurate. From here, the team of researchers examined the kinematic measures for both groups as seen on screen. It was discovered that there were key differences in lower limb kinematics between inaccurate and accurate groups. At heel contact, the accurate group had greater knee flexion, hip flexion, and pelvic tilt in both support and kicking limb. It was also found that greater knee flexion in the support limb increased accuracy as it lowers the centre of mass, hence increasing stability during the swing phases of the kick. A drop punt is a very complex movement in the game of AFL, with many factors contributing to kick performance. As seen in the diagram shown on screen, the 2 main factors are projectile motion and ball accuracy. Projectile motion is determined by coordination, ball velocity at impact, distance, and angle of the ball at impact. The factors which influence the accuracy of a drop punt kick include foot-ball contact, ball height at impact, balance, and medial-lateral deviation of the kicking leg. However, during the following analysis, the 2 key areas which will be focused on is the athlete's centre of mass and the position of the kick leg at ball contact. Centre of mass relates directly to the accuracy of the kick, whereas position of kick leg at impact influences both the projectile motion and accuracy. Centre of mass is a key element in drop punt kicking. The lower the athlete's centre of mass is, the greater balance and stability they have when performing the kick. The centre of mass for the individual is easily assessed through examining their degree of knee flexion in the support limb. This will be further examined in the next few slides. The position of the athlete's leg at ball contact can be examined through assessing the athlete's knee and hip flexion during this time. It has been discovered through many studies that greater knee flexion and hip flexion is positively correlated to accuracy. An athlete performed a drop punt kick within a laboratory setting to be examined for testing of accuracy. 2 measurements were taken, heel contact and ball contact. These were chosen as they were used in previous studies, and this will allow the results from this study to be accurately compared to those of the previous. Heel contact is defined as the point at which the support foot contacts the ground and should be made with the heel initially hitting the ground, whereas ball contact is defined as the instant the foot initially contacts the ball. The table shown on screen explores the joint angles of key segments involved in punt kicking by the subject. When comparing this table to the results of Dicciera and colleagues' study, it is evident that there are some similarities and differences. The athlete has one key area in which their kicking technique requires minimal change, and in fact exhibits similar ranges and angles to the accurate group. Hip flexion of the kicking limb is a key area in the athlete's technique where no improvement is required. He exhibits angles between the inaccurate and accurate group, however, they are closer to the accurate group and contain similar ranges. The key areas required for improvement within this athlete's technique include knee and hip flexion of the support limb, knee flexion of the kicking limb, and pelvic tilt. Hip flexion of the support limb and knee flexion of the kicking limb need to be improved relatively quickly in order to avoid potential tears in corresponding muscles. Knee flexion of the support limb is the highest priority as it forms the base of stability during the kicking phase. The athlete's knee flexion of their support leg is their weakest characteristic of their kick. Knee flexion in the support limb is supposed to have the largest range of motion so that the athlete has a lowest centre of mass, hence increasing stability. The athlete has a small range of just 6 degrees and his centre of mass is not low enough to the ground compared to that of the accurate group of previous studies. The athlete's hip flexion of their support limb is another key area in which improvement is required. Their range of motion is very minimal, being only 2 degrees. This limits the back and forward swing phases of the kick. This small range of motion may be due to hamstring tightness, limiting the degree to which the thigh is able to flex towards the hip. The knee flexion of the kicking limb is of equal priority to the hip flexion of the support limb. According to the study conducted by Dicciera and colleagues, from heel contact to ball contact, the kicking limb should positively progress, having a range of approximately 40 degrees. However, for this athlete, they only have a range of -9 degrees, which is significantly different. Hence, this could strongly impair the athlete's accuracy. This could be due to tightness in quadricep muscles causing the athlete to be limited in the degree of knee flexion. Tightness in the quadriceps and hamstring muscles may potentially cause a tear if overstretched without adequate flexibility of these muscles. Therefore, through stretching these muscles, it may prevent injury occurrence. The pelvic tilt at heel contact was considerably closer to the inaccurate group of the previous study, and their ball contact was much higher than both the accurate and inaccurate group. This indicates that the athlete has a small range in pelvic tilt and may contribute to an inaccurate kick. The main intervention used to improve the athlete's kicking performance is feedback. Through use of feedback during training sessions, along with video feedback post-training, will be beneficial for the athlete. Analysis software such as Canovia will be utilized to track the athlete's improvement in the areas where improvement is required. Training sessions will be prescribed to the individual to improve knee flexion of kicking and support limb, hip flexion of support limb, and pelvic tilt. To improve the athlete's centre of mass, the degree of knee flexion at ball contact needs to be reduced. Through improving the athlete's core strength, the stability of the athlete is increased and is known to lower their centre of mass. Therefore, a session focusing predominantly on improving abdominal strength will be prescribed. Along with this, there will also be a session focusing on simple drop punt kicking, along with decreasing the angle of knee flexion. Through repetition, the athlete will naturally adapt to the technique of kicking, however, it may take time. In order to improve the degree of knee flexion in the kicking limb and hip flexion of the support limb, static and dynamic stretches will be incorporated into a session. This will be performed 3 times for each stretch, held for 30 to 60 seconds, and performed 4 to 5 times a week. The stretches performed will be similar to those shown on screen, primarily targeting the quadriceps and hamstring muscles. The aim of this is to increase the muscles' flexibility, creating a larger range of motion during kicking and also reduce their risk of injury. The intervention will also lead to improving the athlete's centre of mass through the advancement of their flexibility. Another key area needed for improvement is pelvic tilt. This can easily be adjusted through practice. This can be improved by placing a pole over the athlete's lower back at an appropriate pressure to make the athlete adjust their tilt during kicking. This will lead to improving their accuracy.